Hello, I'm Hematologist Oncologist Dr. Tony Talebi. Today we're going to discuss liver cancer. I have the pleasure of being with Dr. Feun, Professor of Medicine at the University of Miami. Thank you for being here.
My pleasure.
Dr. Feun, before we begin, would you please explain what the liver is and why is it so vital to survival?
The liver is a major organ of the body which deals with metabolism. It's important in terms of detoxifying certain chemicals in the body. It's important in terms of synthesis of certain proteins, so it's a major organ of the body.
It really is an amazing organ. So please explain, what is liver cancer?
Liver cancer is a tumor, can be benign or malignant, and it arises from the liver itself.
Why do liver cells become cancerous?
There are many different reasons. There are complex reasons. It mainly does to liver injury. It can be from various drugs, alcohol, from various infections, various chemicals, some various metabolic disorders can all cause injury to the liver, which leads to liver cancer.
I see. So it sounds like the chronic inflammation is finally what converts the liver cells into cancerous
That's
cells?
an important process, yes.
I see. What are some risk factors that patients should be aware of?
In the United States, the risk factors we're particularly concerned about are hepatitis C and B and chronic alcoholism.
Let's talk about the hepatitis virus. How does the virus incorporate into the liver and eventually cause liver cancer?
With hepatitis C, there is a chronic injury to liver. This leads to liver cirrhosis, which is scarring. After a period of a number of years, the scarring of the liver leads eventually to cancer arising from the damaged cells.
I see. So it sounds like it's the body's response to the infection which actually causes the damage to the liver cells?
Well, cells, when they're damaged, they eventually undergo various mutations, and these mutations will eventually lead to liver cancer.
I see. What about alcoholism? How does that lead to liver cancer?
Well, the liver is chronically damaged by alcohol. After many years, you get cirrhosis, which is scarring, and again, this leads again to damage and mutated cells, eventually leads to liver cancer.
I see. What about some more rare diseases such as hemochromatosis or porphyria? Why do they have a high risk of liver cancer?
Well, there's various injury to the liver, from hemochromatosis, which is deposition of iron in the liver, to various toxic compounds, to various metabolic disorders. The key is that the liver cells are injured in some way. They undergo mutations which eventually lead to liver cancer.
I see. What about the aflatoxin, which is more pronounced in other parts of the world besides the United States?
Right. That's aflatoxin is related to a fungal product. It can poison the liver, and eventually it leads to a damaged liver, which again leads eventually to liver cancer.
I see. So it's a chronic recurring theme, the constant inflammation.
Right. The chronic injury to liver.
There's a phenomenon that's occurring more and more in the United States, which is called fatty liver, which is from overeating. Would you please explain what that is and how does that lead to cirrhosis and eventually possibly cancer?
Well, fatty liver is due to a number of reasons. Fatty liver is a generally reversible condition where you have these vacuoles or droplets of triglyceride fat deposited inside the liver cells. And for various reasons, this may eventually lead to liver injury and eventually lead to liver cancer.
What if the patient loses weight? Can that reverse itself?
There are various reasons that cause fatty livers, anything from drinking alcohol to various high triglycerides. So when change the lifestyle, it may help to reduce the chances of having fatty liver. It may reverse the fatty liver.
I see. So these high-risk populations that we discussed, would you recommend screening tests for liver cancer in these populations?
Patients who have a history of high risk, patients who have a history of hemochromatosis, patients who have heavy exposure to various chemicals, patients who are heavy drinkers, it's important for them to see their doctor, discuss with the doctor the screening process, because prevention, changing lifestyle can be important, and screening may be important for picking up early liver cancer.
I see. What are some general signs and symptoms of liver cancer? Why do some patients turn yellow?
There are various signs and symptoms of liver cancer. They can be fatigue, weight loss. They become jaundice, where the liver cells are damaged or the liver bile ducts are obstructed, and the eyes become yellow from the buildup of the bilirubin. They can have abdominal pain, particularly right side abdominal pain, nausea, generalized weakness and fatigue are some of the symptoms of liver cancer.
Is there ever a time where you refer your patients for genetic counseling when they've been diagnosed with liver cancer?
If there's a high incidence of liver cancer in the families, then I think it's important to have genetic counseling to see if there's some underlying genetic reason for that. Most liver cancer is not inherited, but there are occasionally could be rare families where liver cancer is predominant.
I see. Now, there's a very important tumor marker that is very important in your field called alpha-fetoprotein. That's usually seen in pregnancy. How is that helpful for a liver specialist?
Well, the serum alpha-fetoprotein is elevated in more than half of the patients with liver cancers, and so if it becomes high, it should lead to a workup and screening for liver cancers. There are various causes of having high alpha-fetoprotein. Sometimes acute liver injury, like from a virus, can cause elevated alpha-fetoprotein. Cancers of the testicles in male, germ cell tumors in women, females. But a patient who has a history of liver disease, a high alpha-fetoprotein should warrant a close evaluation.
We'll get to the specifics of the treatment later, but let's assume someone with a high risk has elevated alpha-fetoprotein or a liver mass. Generally speaking, what happens next for that patient?
Well, they would get some additional blood tests. They should probably get specialized scans of the liver. Depending upon the results of the scans of the liver and the tumor markers, the alpha-fetoprotein, a biopsy might be indicated in certain patients.
I see. And patients always ask us, should they change their diets once they've been diagnosed with liver cancer?
The liver metabolizes protein, so a patient would have significant jaundice where they cannot handle a high protein load. It may be important to take less high proteins and maybe more carbohydrates, fresh fruits and vegetables. If they don't have severe liver damage, they may normally, but if they have significant jaundice, then they may have to reduce the protein load because the liver cannot metabolize and handle those proteins.
I see. Family members ask us, if a patient's been diagnosed with liver cancer, do the close family members need to have alpha-fetoprotein checked or a liver ultrasound?
Generally speaking, that's not standard practice, but if there's a history of liver cancer running in a family, then I think it'd be more important to screen those people.
Are there any support groups that you refer your patients to?
Support groups are available through various organizations, the American Cancer Society. There are liver cancer support groups that can be found through the internet. We also provide support here at Sylvester.
Great. Well, thank you so much. Thank you for watching. We hope this has been educational for you as well.